Hi, this is part 2 of my 5-part series about red flag symptoms, scary stuff that you need to look for that would make you want to go straight to the hospital or talk to your doctor, and stuff that you don't want to just blow off until the morning. Most of you would be thinking, well, of course I'm going to go see a doctor, but you'd be surprised how many people wait. So let's talk about some of the ones that might be obvious to you, but not to a family member, that you can look out for. So if you notice it, you can be sure to get them in right away. So a thunderclap headache, or the worst headache of your entire life, comes on suddenly, severe pain. We worry about an aneurysm somewhere in your brain. So if you have that, you have to get in right away. And I don't recommend going straight to your doctor as an outpatient or into an urgent care, because you're gonna need head imaging. So you wanna go straight to the hospital for that one. And if it's severe, obviously calling an ambulance, right? It's always safer to do that than drive yourself, especially in that case. There's a symptom that you might not notice if you're having it. If you're having slurred speech, a family member or a friend might pick up on it before you do. Remember, if you're slurring your words or really having a hard time even finding words and stumbling over them, that might be one of the first signs of a stroke, or a TIA, which is a mini stroke. I've got other videos talking about those. Be sure to check them out for specific details. But if you are noticing this in a friend or a family member, or you really might notice it yourself, that is something to seek medical care for immediately. Remember, in cases of a stroke, we have a limited window where we can give a medication to break up the blood clot that could be the cause of a stroke. There's other causes as well, but if you're having that, you only have a little bit of time to get in and get the care that you need. So if you're having these symptoms, you need to be seen right away. The other thing you want to make sure about if you're having slurred speech or confusion, right? Say you just really feel disoriented, or you had a head injury, you fell, you got right back up, you felt fine, but you have that headache still not throbbing. Those are things to seek medical care for. And a lot of the times, if this is an acute thing that just happened, you're gonna wanna skip the office, you're gonna wanna skip urgent care and go straight to the hospital, because you're going to need head imaging in a lot of these cases. And you can't get that in outpatient situations, especially not urgently. So if this happens to you, make sure that you go in right away. This last one's kind of interesting. It's called the feeling of impending doom. We actually read about it in medical school literature, and different books will talk to you about a patient actually can tell you sometimes when they're about to die. I had it happen my very first month as an intern on internal medicine rounds in an intercity hospital, and it terrified me because the patient said, "I'm gonna die," and just kept screaming, "I'm gonna die," and they were totally healthy, totally stable, and sure enough, about 30 minutes later, the patient died unexpectedly and suddenly from an aneurysm. And what we learned from the situation is sometimes patients absolutely have that sense that something is going on. If you suddenly feel severe discomfort, something is wrong and you know it, it very well could be something like this. It's something that you want to talk to your doctor for sure about. But also think about the fact that it could also be a panic attack. A lot of times people have this severe, overwhelming anxiety, and it manifests in physical stuff. Like, it's not just anxious stuff, right? So you can feel crushing chest pain. You can feel trouble breathing. You can have the worst headache. You can have shaking, tremor, confusion, trouble talking. You feel overwhelmed. This is something that can be controlled with medication, but how would we know it's nothing else unless we worked it up? Something absolutely to see your doctor for. If you like this, be sure to watch my other videos where I talk more about other red flag symptoms and things that you have to have medical care for and stuff to not blow off.